Just a nurse. That's what the chart said, or might as well have. Laura Bennett pushed the fustand toward bed 412 with the kind of economy of motion that came from muscle memory honed in places that didn't exist on any map. 6:15 in the morning. Mercy General's pediatric ward hadn't yet filled with the day's chaos, and the fluorescent lights hummed their mechanical hymn over empty hallways. She had learned to move through hospitals the same way she'd learned to move through Marjah, present but unobtrusive, helpful but unremarkable, the kind of person people looked through rather than at. The antiseptic smell of the ward wrapped around her like a familiar coat. Bleach and saline solution and something metallic underneath. She'd grown accustomed to it in the 3 years since she arrived at Mercy General, since the paperwork had been filed and sealed and the woman she used to be had been officially erased from every military database. Senior Chief Petty Officer Laura Bennett didn't exist anymore. The Navy had buried her so completely that even her birth certificate came back with inconsistencies now. What remained was a quiet nurse in scrubs, unremarkable competence, and the ability to disappear in plain sight. Bed for 12 held an 8-year-old girl with no hair. Emma Mitchell lay against white pillows with the stillness of a child who had learned that doctors were supposed to make her feel better, but nothing seemed to work. Patches of her scalp showed pink and vulnerable where her hair had fallen out in clumps over the past 4 months. Her father sat in the visitor's chair, uniform crisp as a military crease, captain's bars catching the morning light. Captain Marcus Mitchell, Army Ranger, 75th Ranger Regiment, the clipboard had told Laura that much. What it didn't say was the way his jaw clenched every time a new specialist walked through the door with another diagnosis that contradicted the last one. 3 pediatricians. 2 dermatologists. An endocrinologist. An oncologist. All 7 had examined Emma. All 7 had agreed on alopecia areata, an autoimmune disorder where the body turned against its own hair follicles. Treatable. Usually manageable. Nothing to fear. Except nothing was working, and Emma's hair kept falling out, and Captain Mitchell's jaw kept clenching. "Good morning, Emma," Laura said, keeping her voice steady and level. "I'm going to check your foreplacement. Let me know if anything feels uncomfortable." She approached the forecatheter taped to Emma's small arm without the hovering concern that some nurses deployed like armor. "No, poor thing, Gord, you are so brave. Just competence. Just the work." She'd learned long ago that sick children needed certainty more than sympathy. They needed to believe the person caring for them knew exactly what they were doing. Her hands moved with the kind of precision that came from inserting 4s in field conditions, on a Black Hawk in transit, in a forward operating base with shaking lighting, on a casualty whose veins had already collapsed. Laura examined the tape seal, the angle of approach, the slight discoloration around the insertion point. All good. She adjusted the forestand's height by 2 centimeters, enough to improve the flow rate by roughly 8%. Small adjustments. Invisible adjustments. The kind that went unnoticed unless you were trained to see them. Captain Mitchell watched her work. She felt his attention the way you feel a weight shift in a room. Military people noticed precision. They understood the vocabulary of hands that knew their work. "She's been having trouble sleeping," the captain said. His voice came out careful, like he was still trying to make sense of something that refused to add up. "The doctors said it was anxiety about the hair loss. But she hasn't had any stomach issues. No fevers. Just the hair, and she feels fine otherwise." "That's important information," Laura said, and she meant it. She looked at Emma directly. "When did it start falling out? Do you remember what you were doing?" "We were at Fort Benning," Emma said, her voice small but precise, a captain's daughter learning to report facts. "Like 2 months before the first patches. We'd been there about a month. There was construction near our house. Really loud. And the water tasted weird sometimes." Laura's hands didn't pause in their work. Her expression didn't change. But something in her chest shifted, like a door opening onto something dark. Water. 2 months before symptoms. Progressive hair loss over 4 months. 7 doctors looking at the child in front of them and missing the environment that had shaped her. "Thank you," Emma, Laura said. That helps. She finished adjusting the 4, checked the flow rate one more time, now reading 42 milliliters per hour, optimal, and made a note on the chart. Not about the 4 adjustment. Not yet. She'd learned that lesson too, long ago. You didn't make observations before you had confirmation. You didn't sound alarms based on suspicion. You gathered data, synthesized it, and presented it only when you had something solid enough to stand on. Senior Chief Petty Officer Laura Bennett had written reports like that once. Young girl in a uniform getting it right, getting it noticed, getting pulled into operations that eventually pulled her under. This Laura just documented for patency and moved to the next bed. But the information stayed with her, turning over in her mind like a piece of shrapnel too close to the spine to safely remove. The ward filled gradually as morning proper arrived. Nurses changed shifts. Doctors began their rounds. Laura moved between beds with practiced rhythm, vital signs flowing together in a fluid sequence: temperature, pulse, respiration, blood pressure, oxygen saturation. Numbers that told stories if you knew how to read them. She'd learned to read vital signs the way soldiers read terrain, understanding what the data meant about what was happening underneath the surface. By 7 o'clock, the pediatric wing had achieved its full morning chaos. 2 admissions on the night shift, 1 discharge, 1 family in crisis mode down in bed 405 because their daughter's blood work had come back with results nobody had expected. The charge nurse was already 3 conversations behind. The resident on call looked like she'd made it through the night on coffee and spite. And in bed for 11, next to Emma Mitchell's room, a man in scrubs sat next to a hospital bed and watched the morning with a kind of stillness that comes from military bearing. His daughter, the chart said, was 7 years old. Severe asthma. Admitted 3 days ago, responding to treatment, scheduled for discharge this afternoon. The man in scrubs had Army Ranger tattoos on his forearm, the distinctive curved Ranger tab over a scroll with coordinates. His presence had the quality of someone used to standing watch, used to being present without requiring acknowledgement. Laura moved past his bed carrying fresh linens, and his eyes tracked her movement. Not in the casual way most people looked at hospital staff. The way someone with training tracked efficiency of motion. She felt his attention focus for just a moment, and then he looked away. But not before she noticed something in his expression shift, a calculation, a recognition, a door opening just slightly. She didn't acknowledge it. She'd learned not to acknowledge things that might lead to questions. Instead, she focused on the work. Because the work was what mattered now. The work was what you did to stay invisible, to stay buried, to stay alive in a life that wasn't supposed to exist anymore. By 8 o'clock, the morning rounds were scheduled to begin. Dr. Sterling arrived the way he always did, expensive shoes clicking against linoleum tiles like a countdown timer nobody wanted to hear. He carried Emma's chart like it was a mild annoyance, something that required his attention only because protocol demanded it. He hadn't worked pediatrics in 15 years, Laura had learned. He was here because he was chief of medicine and rounds required his presence. His presence here was about authority, not about Emma. Mr. Mitchell, Dr. Sterling said, nodding at the captain without offering a handshake. I've reviewed the work done by the consulting specialists. We have a clear diagnosis of alopecia areata. This is an autoimmune condition, manageable with topical corticosteroids and immunosuppressant therapy. Your daughter will be fine. Captain Mitchell stood. His hands went still at his sides, military bearing asserting itself. 7 doctors and nobody has asked her what was happening when the hair loss started. Nothing about environment. Nothing about possible exposures. Because alopecia areata is autoimmune, Captain. It's not caused by exposure. It's the body attacking itself. Laura was standing at the forepole, checking the bag of fluid running into Emma's arm. She wasn't watching the conversation. She was just working. Just a nurse doing her job. Her hands moved with the precision of someone inspecting a weapon for defects, and the Army Ranger in bed 411 watched those hands move, and his eyes narrowed the way eyes narrow when you see something you weren't expecting to see. So that's it, Captain Mitchell said. His voice had gone very quiet. "That's the answer." "That's the answer," Dr. Sterling confirmed, and he made a note on the chart that Laura noticed he made without actually examining Emma. He was documenting a decision he'd already made before he'd walked in the room. She should have said something. Later, when she thought about it in the dark hours before dawn, she would know that. She should have spoken up. Should have asked the questions that 7 doctors had missed. But she also knew that a nurse who asked questions had a way of being remembered, and being remembered had a way of triggering background checks that exposed inconsistencies in credentials that were supposed to be airtight. So she finished adjusting before. She said nothing. And in bed for 11, the Army Ranger with the Ranger tattoo watched her not speak, and his jaw tightened in a way that suggested he understood exactly what he was witnessing, a woman choosing survival over speaking the truth she was carrying. Dr. Sterling clicked his shoes back down the hallway, and the morning rounds continued, and Emma Mitchell lay under white sheets with patches of her scalp showing pink and vulnerable, and nobody had asked about the water. The morning rounds moved through the pediatric ward like a surgical team cutting through tissue, efficient, practiced, cold. Dr. Sterling led with his hands clasped behind his back, his white coat pressed so sharply it looked like it could cut. The residents trailed behind him, notepads ready, voices small. Laura stood at the nurse's station reviewing Emma Mitchell's chart, her fingers tracing the medication orders, when she caught the pattern that had been invisible to 7 different specialists. The mislines on Emma's nail beds weren't prominent, but they were there, horizontal white lines that shouldn't be there. The burning feet the child had mentioned to Laura at midnight, the nausea that worsened after meals, the hair loss that didn't follow the typical patchy distribution of alopecia areata. It followed a pattern. A progression. Something systemic. When Dr. Sterling approached Emma's room with his entourage, Laura made her choice. She stepped forward quietly, her voice steady and deferential the way it always was. "Doctor, I was wondering if we might consider systemic toxicity screening." The hair loss pattern, combined with the neuropathic complaints Emma mentioned. Dr. Sterling stopped mid-stride like he'd walked into glass. He turned slowly. His eyes found hers, and the hallway seemed to hold its breath. 5 seconds of silence stretched like surgery. The residents shifted their weight. A blood pressure cuff deflated somewhere down the corridor with a soft hiss. "Excuse me." His voice dripped contempt like antiseptic from a dispenser. "Did the four-pole just give me a differential diagnosis?" The residents laughed. The sound was nervous, high-pitched, the laughter of people who knew better but couldn't stop themselves. Laura's jaw tightened by maybe a millimeter. She opened her mouth but he continued, his voice climbing, his presence expanding to fill the space like pressurized air. 7 specialists have examined this child. 7. With a combined 60 years of medical education. Pediatric dermatology, endocrinology, oncology. But please, Nurse Bennett, enlighten us with your associate's degree. He wasn't finished. He never was. Dr. Sterling slammed Emma's chart onto the nurse's station with enough force that pens jumped and rolled. The crack echoed down the hallway like a gunshot. 2 nurses 3 doors down looked up from their work. "Pick that up, sweetheart," he said, his voice sweet as spoiled milk. "Your job is following orders, not pretending you went to medical school." Laura took one measured breath. She let her eyes meet his, not with anger, not with hurt, but with the kind of calm that comes from having already survived the worst. Her hands were steady when she wiped away the single tear that escaped, the only concession her body made to the rage she kept locked behind her ribs like classified documents. When she spoke, her voice was so quiet the residents had to lean closer to hear it. "Captain Mitchell trusts me with his daughter's life." "Doctor, that should concern you." The silence that followed wasn't awkward. It was surgical. It was the silence of a room realizing something fundamental had shifted, like watching a patient's monitor change from irregular to stable. Dr. Sterling's face flushed from his collar upward, the color spreading like an infection. He opened his mouth. Closed it. Then he turned back toward Emma's room, his residents scrambling behind him like confused ducklings. Laura picked up the chart herself. Her hands didn't shake. They moved with the same precision that had once held torn arteries together under fire, that had stitched field wounds closed with whatever thread the medics had on them, that had performed emergency procedures in a Taliban stronghold while rounds went overhead. The muscle memory of survival ran deeper than the humiliation of this moment. That afternoon, the cafeteria smelled like industrial chicken and the acrid bite of burned coffee. Laura carried her lunch tray through the crowd, turkey sandwich, cup of soup, apple, when she heard Dr. Sterling's voice carry across a table of physicians like he was making a toast. "I'll bet anyone here $50 that Nurse Bennett quits within a week." He didn't look up from his phone. Some people can't handle knowing their place. Laura was 3 feet away when his foot extended slightly, casually, the way someone might stretch. Her tray crashed to the floor. Salad exploded across the tile. Soup splashed her shoes. The room went silent except for the sound of broth dripping. "Oops," he said, still not looking up. "Better clean that up before someone slips." 14 staff members watched her. Laura kneeled to pick up the debris without hesitation, without anger visible on her face, without a single tremor in her hands. She gathered the broken bowl, the scattered letters, the napkins now soaked in vegetable soup. A younger nurse moved to help her, but Laura waved her off with a tiny shake of her head. "Do not. This is mine to carry." When she stood, her hands were clean but her soul felt dirty in a way that showed nowhere on her face. She walked to the trash bin and disposed of the wreckage, rinsed her shoes at the sink, and clocked back into the pediatric ward like nothing had happened. But something had. Dr. Sterling had drawn a line, and Laura had crossed it without fighting, without defending herself, without giving him the satisfaction of seeing her break. The quiet made him furious. Humiliation worked best when the victim cried. When they quit. When they left. Laura's composure, her refusal to shatter on command, infuriated him more than any argument could have. On Emma's 6th day in the hospital, Laura sat in the break room during the midnight hours when the ward went quiet and the fluorescent light seemed to hum at a different frequency. She had pulled Emma's environmental history from Captain Mitchell's intake forms. The family had lived at Fort Benning for 18 months, base housing near the old ordnance testing grounds. The well water that tasted metallic. The way Emma's symptoms had started 3 months after their arrival in Savannah, during the transition period when they were using that well water before the city hookup was completed. Mislines. Neuropathy. Progressive alopecia. Nausea and weight loss. Not alopecia areata. Something else. Something from the ground or the water or the air from a place that had done things humans shouldn't ask them to do. She was documenting her observations, careful clinical notes that would become useless as soon as Dr. Sterling saw them, when the Army Ranger medic appeared at the break room doorway. The man from room 413 whose daughter had pneumonia, whose eyes had watched Laura's hands during Emma's blood draw with an intensity that suggested recognition. He sat down quietly. No greeting. No preamble. "Marjah, 2011, he said, his voice low enough that the hallway monitor wouldn't catch it. "You're the one who did the field arterial repair on Lieutenant Vasquez under fire." "I was there. I watched you work." Laura's hands went cold. The clipboard slipped slightly before she caught it. "I think you have me confused with someone else. I've never been to Afghanistan." But the lie came out small and hollow. Her trembling hand knocked over her coffee cup. Brown liquid spread across the table like a map of countries she wasn't supposed to have visited. The medic watched it spread without offering to clean it up. "Understood," he said quietly. He stood to leave, then paused. "But that technique, the way you stabilized that radial artery with nothing but combat gauze and a prayer, I've never seen anyone else do it that way. Just know, if you ever need someone who remembers, I'm in room for 13. He left before she could respond. Laura cleaned up the spilled coffee with paper towels, her hands eventually steadying, the trembling subsiding back below the surface where she kept all her secrets. She requested heavy metal screening for Emma the next morning, a full panel, lead, mercury, cadmium, thallium, arsenic. Dr. Sterling blocked the order within an hour, writing in Emma's chart in his aggressive cursive, "Nurse Bennett continues to overstep." Disregard non-medical personnel suggestions. Recommend reassignment if this behavior continues. But that wasn't the worst part. Emma's condition worsened. More hair falling out in clumps when she showered. Her appetite disappeared entirely. She complained of burning in her feet that woke her at night. Weight loss accelerated to 2 pounds per week. Captain Mitchell appeared in the hallway on day 8, his uniform immaculate but his face fractured with desperation, and found Laura at the nurse's station during a break. "What do you think is wrong with my daughter?" he asked quietly. His voice carried the weight of command even in a whisper. "What do you actually think?" Laura looked at him for a long moment. She knew the answer. She knew what no one else had seen. She also knew that speaking would mark her, that Dr. Sterling would retaliate, that her career at Mercy General was already measured in days if she kept pushing against him. "Get Emma's well water tested," she said. "Privately. Don't wait for the hospital. Take it to an independent lab in Atlanta. Have them run a full heavy metal panel. And don't ask Dr. Sterling's permission." Captain Mitchell's eyes widened slightly. He nodded once, sharply, the gesture of a man who recognized an order when he heard one, even coming from someone wearing scrubs instead of rank. On Emma's 6th day in the hospital, Laura noticed something the 7 other doctors had missed. Mislines. White horizontal striations across the child's thumbnail beds, thin as pencil marks, the kind of detail that lived in the margins of medical school textbooks and almost never appeared in real patients until the poisoning was already advanced. She documented it in a chart with a timestamp, 14:06 hours. Not because she expected anyone to read it. Because the truth demanded to be recorded, even if no one was listening. Emma complained of burning in her feet that morning during vitals. Like ants, the 8-year-old said, her voice small against the mechanical wheeze of the room. Laura checked her reflexes, slightly delayed, just enough that a distracted examiner would miss it. Ankle reflexes slower than knee reflexes. Ascending peripheral neuropathy. The pattern was textbook thallium toxicity, the kind of constellation of symptoms that announced itself only to people who understood that poison didn't announce itself loudly. It whispered. It hid in hair loss and nail beds and burning extremities and reflexes that lagged a half-second too long. Laura's hands moved with the precision of someone who had done this before, not on civilians in a hospital, but on soldiers in Fallujah and Sanjan Valley, where the difference between missing a detail and catching it meant the difference between a Marine going home to his family or being flagged for the mortuary. She trained herself to see what wasn't obvious. To find the story the body was trying to tell, even when it was written in languages other people couldn't read. That evening, sitting in the break room with Emma's chart spread across her lap like a map, Laura traced backward through the family's recent history. Captain Mitchell had mentioned it casually during visiting hours. They'd just transferred from Fort Stewart, Georgia, where Emma had spent the last 8 months. Fort Stewart. Which meant the base's water system. Which meant if the well had been contaminated, if someone hadn't caught the thallium levels early enough, if the base commander hadn't ordered testing, then 8 months of exposure for a 90-pound child would produce exactly this progression of symptoms. Hair loss starting for months ago. Neurological complaints emerging in the last 6 weeks. The puzzle pieces locked together with the terrible clarity of a diagnosis that should have been obvious to anyone trained to look for it. But looking required asking the right questions. Looking required treating a nurse's observations as data instead of dismissing them as overreach. Laura pulled up the base medical records on the hospital system, redacted, incomplete, but enough. She found it in a footnote dated 14 months prior, contamination advisory, thallium levels 0.8 micrograms per liter in well site 3. The safe limit was 0.002. The base had been using contaminated water for nearly a year before issuing an advisory that fewer than 30 people had seen. Emma Mitchell had drunk that water every day for 8 months. Every single day. The poison accumulating in her system like a secret, announcing itself only through hair loss that 7 pediatricians, dermatologists, and an endocrinologist had diagnosed as stress alopecia, autoimmune disease, everything except what it actually was. Laura documented it all. Times, dates, findings, the cascade of misdiagnoses. She prepared the presentation carefully, not accusatory, just factual. Just the data. Just the evidence that if they tested Emma's urine for thallium, they would find levels consistent with chronic heavy metal poisoning. Just the suggestion that maybe, just maybe, someone should consider the base's water system as a source. She scheduled a meeting with Dr. Sterling during morning rounds the next day. Waited until he'd finished with his other patients. Approached him with the deference of someone who understood the hierarchy of a hospital, doctors at the top, nurses somewhere in the middle, patients at the bottom, and every one of them understanding exactly where everyone else stood. Dr. Sterling, I'd like to discuss Emma Mitchell's presentation with you. I've noticed several clinical findings that might suggest heavy metal toxicity rather than alopecia areata. He didn't look up from the chart he was reading. Noticed mislines on the nail beds. Delayed reflexes. Paresthesias in the lower extremities. Progressive hair loss preceded by a military relocation to an area with a documented water contamination event. If we tested her urine for thallium. You're a nurse. He said it the way another person might say you're a child or you're a goldfish. A simple statement of categorical limitation. Your job is to monitor vital signs and change bedding. Not to practice medicine. Not to construct diagnoses. Certainly not to second-guess the assessment of 3 pediatricians, 2 dermatologists, and an endocrinologist who have each looked at this case and reached a consensus. Laura didn't flinch. She'd been dismissed by better men than this. Men with actual authority. Men with actual reasons to dismiss her. Sir, I'm not suggesting they were wrong. I'm suggesting the presentation is consistent with. You're suggesting nothing. His voice had dropped, the way voices do when they're about to cut something off at the base. You're observing. You're reporting your observations to your charge nurse, who will relay them to me if they warrant consideration. That is the extent of your scope of practice. Do you understand? The room had gone very quiet. Not the quiet of respect or contemplation. The quiet of a door closing. Laura met his eyes for exactly 1 second, long enough for him to see that she understood the message, short enough that it wasn't defiance. She nodded. Understood, Dr. Sterling. She walked out of the room moving like someone made of composure. Like someone who'd learned long ago that restraint was a weapon and submission was a strategy. Like someone who'd been trained by institutions that understood the difference between backing down and backing away. There was distance between those two things. A very important distance. But the truth about poison is that it doesn't care about hierarchy. It doesn't care about scope of practice. It doesn't care about 7 doctors or 1 dismissive specialist or all the carefully constructed rules about who gets to know what. Poison does what poison does. It accumulates. It compounds. It waits. That evening, Laura sat at her kitchen table in Savannah with the overhead light humming its fluorescent song and her 16-year-old son standing in the kitchen doorway with his backpack still on his shoulder, looking at her the way children look at parents who are supposed to have all the answers but clearly don't. Why are you home early, Mom? She couldn't tell him the truth. Couldn't explain that she'd violated her own careful invisibility by asking the wrong question to the wrong person at the wrong time. Couldn't explain that somewhere in the classified files of the Pentagon, there was a name that wasn't her name attached to orders that had erased her from military records so completely that even now, 18 years after that operation in Marjah where she'd held a lieutenant's femoral artery together under incoming fire and kept him alive through a 2-hour extraction under direct fire, she still didn't officially exist. She couldn't tell him that the kind of courage that got you killed in special operations wasn't the courage to survive. It was the courage to live with the consequences of surviving. To work in a hospital where people didn't know her name. To watch children get sicker every day while you documented the truth in charts no one would read. To sit at a kitchen table at 3 o'clock in the afternoon and realize that the one time you'd risked speaking, the one time you'd stepped outside the carefully constructed invisibility, you'd managed to help exactly 1 person and potentially destroy everything you'd built to protect your son from the knowledge that his mother had killed people for her government and her government had killed her in return, just with more paperwork. Bad day, Laura said. Nothing serious. Her son set down his backpack. He had his father's eyes, the ones that saw too much, understood too much, forgave too easily. "You never have bad days, Mom." She didn't argue with him. She didn't explain. She just nodded and let him believe that she was what he thought she was, a nurse who worked hard and came home tired and loved him more than anything in a world that was generally fair and made sense and didn't involve 7 doctors missing a diagnosis that a senior chief petty officer from a SEAL team that officially didn't exist could spot in the margins of a hospital chart. But that wasn't the worst part. The worst part was that Emma Mitchell's condition was deteriorating. The poison was still in her system. The clock was still running. And Laura had just used up her one chance to warn them before something happened that would force the truth out of her whether she wanted it or not. On Emma's 9th day in the pediatric ward, the fever arrived like an unwelcome visitor at 3 in the morning. Laura noticed it first, a subtle flush across the child's forehead when she came to check the fall line. Temperature spiked to 103.4. By dawn, Emma complained of chest pain, a dull ache she described as like someone sitting on my heart. The monitors began their frantic conversation. Heart rate climbed to 142. Blood pressure dropped from the stable 118 that had held steady for 48 hours to 94/58. Laura's hands didn't move faster than necessary, but they moved with absolute certainty, because she recognized what the 7 specialists had missed. This wasn't a complication of alopecia areata. This was the consequence of heavy metal poisoning manifesting as pericardial effusion, fluid accumulating around the heart, compressing it like a fist slowly closing. At 7:43 a.m., Emma's monitors flatlined into cardiac arrest. The heart stopped. Not from a primary cardiac event, but from the physical pressure of fluid around it, cardiac tamponade. The code team arrived within 90 seconds. Dr. Sterling pushed through the crowd, already barking orders for chest compressions, already reaching for the crash cart. Laura was already moving. She positioned Emma supine with the precision of someone who had done this on a battlefield with incoming rounds and no time for hesitation. The subxiphoid area, the soft triangle below the breastbone, needed to be prepped. Her hands moved like they were reading muscle memory written in scar tissue and adrenaline. No tremor. No doubt. She found the xiphoid process by touch, located the anatomical landmarks the way she had found them 1,000 times before under conditions far worse than a sterile pediatric ICU. A figure materialized beside her. The ranger medic from the adjacent bed, the one who had recognized her hands during the foreplacement weeks ago. He didn't ask permission. He didn't need to. He moved with the synchronized precision of someone who had worked alongside her in the dark, in the dust, when seconds meant survival. Their hands moved in parallel rhythm, his steadying Emma's arm, his body positioned to shield the field from the crash team's chaos. They had never spoken about Marjah. They had never needed to. Laura's fingers found the 30-degree angle. The spinal needle advanced with methodical care. She could feel the layers, skin, subcutaneous tissue, pericardial membrane. Then the subtle pop, that microsecond of resistance vanishing. She was in. The syringe was already in her left hand. She aspirated slowly. Straw-colored fluid filled the barrel. 5 cc, 10 cc, 30 cc. The monitor showed the heart beginning to respond as pressure released around it. 50 cc, 60 cc. She stopped at 60 and withdrew the needle with the same deliberate control. Emma gasped. Not a reflex. A real breath. Her eyes opened. Color returned to her lips like someone was turning up a dimmer switch. The monitor sang the song Laura had been waiting for, sinus rhythm. Steady. Clean. 120 heart rate, dropping toward normal. Blood pressure climbing back toward viable numbers. Captain Mitchell was crying, his hand on his daughter's shoulder, his face understanding nothing except that his daughter was breathing and alive. The crash team stood frozen for 3 full seconds. Then Dr. Sterling stepped forward, his face flushed with the specific rage of someone whose authority had been circumvented. He looked at Emma's chart. At Laura. At the ranger medic standing with his arms crossed, his presence like a wall. What the hell happened here? Sterling's voice was sharp enough to cut glass. Laura didn't move. She didn't apologize. Chronic thallium poisoning from contaminated well water at Fort Benning. The heavy metal was causing both the hair loss and the pericardial effusion. 7 doctors were treating alopecia when they should have been testing environmental toxins. Her voice had dropped an octave from the deferential tone she'd maintained for weeks. It was the voice of someone giving a briefing, not asking permission. Cardiac tamponade. She needed pericardiocentesis. I performed it. The color drained from Sterling's face. Not red now. White. You performed a pericardiocentesis? Without authorization? Without a physician present? He didn't wait for an answer. He turned and walked out of the ICU, his jaw clenched so tight you could see the muscles working beneath the skin. Within an hour, Sterling had activated his network like a man pulling a trigger. 3 hospital board members arrived, personal favors that had been accumulating like compound interest for 15 years. He brought in hospital investigators. He contacted the state licensing board himself. He even reached across state lines to the fabricated nursing school references, finding the inconsistencies he'd been primed to expect. By noon, he was standing in the administrative corridor announcing it to anyone within earshot. This woman may not even be a real nurse. She's performed invasive cardiac procedures without proper credentials. This is criminal. His words fell into the room like stones into still water, creating ripples that spread through every department. By 2 p.m., security arrived at the pediatric ward. Not aggressively. Not with any sense of urgency. Just with the administrative finality of protocol. Laura was still wearing scrubs. She still had Emma's post-procedure notes in her hands. She didn't resist. She didn't argue. She simply removed her badge and walked with them toward the elevator, passing Captain Mitchell in the hallway. He tried to follow, tried to intervene, but hospital legal was already there with the word pending investigation and the phrase restricted from discussing this matter. The doors closed. She was gone. Laura drove home in silence. Not the kind of silence that comes from peace. The kind that comes from a system shutting down to preserve what little function remains. She arrived at the house at 3:17 p.m. on a Wednesday afternoon when she should have been in scrubs, checking vitals, adjusting medication drips. Her 16-year-old son looked up from his homework at the kitchen table, confused. "Mom? Why are you home?" His voice carried the particular panic of children when their world's architecture suddenly shifts. She sat down at the table without answering. The tears came quietly, not the theatrical kind, but the exhausted kind that comes from holding something impossible for so long that release feels like catastrophic failure. She couldn't explain. How could she explain that Senior Chief Petty Officer Laura Bennett officially didn't exist anymore? That she'd been ordered to disappear after Marjah? That she'd saved a child's life using skills the Pentagon had ordered her to erase, and now she was being destroyed for surfacing at all? The security guard's hand was on her elbow, gentle but immovable, as he walked her through the pediatric ward sliding doors into the Savannah heat. Her badge, already deactivated, sat on the nurse's station desk behind them like evidence. It wasn't even noon. Within 1 hour of Emma's stabilization, Dr. Sterling had activated every favor in his network. 3 board members answered his calls immediately. The hospital administrator listened without interrupting while Sterling laid out his case with the precision of a prosecutor. Laura Bennett's credentials didn't match her resume. Her nursing school had no record of her in their database. The state licensing board received his inquiry at 10:56 a.m., forwarded by email with attachments. He'd contacted her references personally, all of them fabrications, of course, and watched as the inconsistencies accumulated like evidence at a crime scene. "She's a security risk," he'd told them. "We have no idea who she actually is." The air in the parking lot shimmered. Asphalt radiated heat like a landing zone. Laura stood motionless for exactly 4 seconds, then walked to her car without looking back. She didn't run. She didn't let anyone see her hands clench. The tremor wasn't fear, it was something older, something from Marjah, a recognition of losing ground in a battle she'd never been permitted to fight openly. Her phone buzzed as she reached her sedan. A text from the hospital's legal department: "You are suspended pending investigation into unauthorized medical procedures. Do not return to Mercy General premises." The next text came from the state licensing board at 1:15 p.m. An inquiry had been opened. They would need to speak with her within 72 hours. Then a third text from the hospital's Human Resources Department, forwarded through the administrator's office: "Effective immediately, your employment is terminated due to protocol violations and inability to provide verifiable professional credentials. Security was instructed to escort you from the premises pending investigation. Your final paycheck will be mailed to your home address." By 3 p.m., Laura was sitting at her kitchen table in the small house she rented on East 47th Street, staring at a cup of coffee that had gone cold an hour ago. The kitchen smelled like nothing, not antiseptic, not diesel, not the copper tang of a field medical kit. Just old wood and dust and the particular silence of a life coming apart. Her hands lay flat on the table, steady as surgical steel. But steadiness wasn't the same as safety. Steadiness was just training. Training couldn't explain why her career had evaporated in 3 hours, why every door had simultaneously locked, why the skills that had saved Emma's life were now classified as crimes. Her 16-year-old son, Marcus, walked through the back door still in his school uniform, his Savannah High School cross-country medal catching the afternoon light. His backpack hit the floor with a thud. He was talking about his history test before he actually looked at her. Then he stopped mid-sentence. His mother was crying at the kitchen table at 3 o'clock on a Tuesday. Marcus had never seen that before. Not once in 16 years. Not when his father had left. Not after the accident that nearly took his grandmother. Not ever. "Mom." His voice cracked up slightly, the way it did when he was scared. "Why are you home? Did something happen?" Laura couldn't answer. How could she explain? That she was Senior Chief Petty Officer Laura Bennett, officially erased from Department of Defense records after a classified operation in 2011. That she'd been ordered to disappear into civilian life, to stop being a warrior, to work as a nurse in a hospital where she could help without drawing attention from the classified shadows that followed her. That she'd saved a child's life tonight using techniques that technically didn't exist, performed by a person who officially never existed. And now that invisible woman was being destroyed for surfacing. "It's fine, sweetheart. Just a rough day at work." She wiped her eyes once, deliberately, and set her face back to neutral. "I'm okay." But she wasn't okay. And her son knew it. The next morning at 8 a.m., Marcus walked into the Mercy General Administration building carrying a shadow box. He was still in his school uniform, hadn't even changed, because he'd gone directly from the hospital after his first period. The board members were already assembled in the conference room, Sterling among them, his expression confident. He'd orchestrated Laura's termination perfectly. He'd neutralized the threat. He'd protected his reputation. He'd won. Then a 16-year-old in a Savannah High School cross-country uniform set a wooden shadow box on the conference table. "My mom needs you to see this," Marcus said, his voice steady in a way that made every adult in the room pay attention. "My mom is Senior Chief Petty Officer Laura Bennett. And these are her real credentials." The shadow box contained a Navy cross on a ribbon the color of blood and gold. Below it, 2 silver stars, their rays catching the fluorescent light. And sewn into the lining of a faded combat jacket, nearly invisible unless you knew to look, the SEAL Team 3 unit patch, a trident crossed with lightning bolts, the insignia of warriors who operated in the spaces between official history and classified truth. Captain Mitchell stood from his chair. When he saw the patch, he said 2 words, "Senior Chief." His voice cracked on the second word. He understood. Everyone who'd served understood. Laura Bennett hadn't just worked at his daughter's bedside. She'd done something far more dangerous. She'd saved his child's life while operating with no official authorization, no backup, no legal standing. She'd done what warriors do, exactly what needed to be done, consequences be damned. The hospital administrator's hand trembled as he reached for the shadow box. His fingers traced the Navy Cross. He began reading from his personal file on the laptop in front of him, the one labeled Bennett, L. His voice dropped to a whisper. 18 combat deployments. Classified operation in Helmand Province, 2011. Pericardial hemorrhage emergency response under fire. 2 Purple Hearts. 43 lives saved in direct combat situations. Recommended for discharge with full honors and protective identity status through the Pentagon's classified personnel program. The room went so quiet you could hear the ventilator in the ICU 2 floors above, its mechanical breathing the only sound in the entire building. A SEAL team leader who'd flown in overnight, Captain James Holloway, commander of Naval Special Warfare Development Group, stood and named each decoration aloud like scripture. Navy Cross for actions above and beyond in Marjah. Silver Star for extracting a pinned unit under direct enemy fire at the Helmand Bridge. Another Silver Star for the Safe House operation, Operation Lynx. Each medal. Each name. Each moment. The silence in the room was the kind that comes after someone speaks truth that changes everything. 2 FBI agents stepped forward with federal warrants. They explained quietly that Dr. Sterling's inquiries into Laura Bennett's identity had triggered alerts on a protected classified status. His phone calls to her references, his contact with the state licensing board, his demands for credential verification, all of it constituted federal obstruction of a classified personnel program. His attempt to expose her identity was a violation of 18 U.S.C. Section 798. Espionage. Obstruction. Witness tampering. You have the right to remain silent, one of the agents said, and Dr. Sterling's face went the color of old bone. They cuffed him at 9:17 a.m. in front of the entire hospital board. His wrists went into restraints with the quiet click of metal engaging. He opened his mouth 3 times, closed it 3 times. There were no words left. The architect of institutional power suddenly became a man with no authority at all, arrested in the building where he'd ruled by intimidation, escorted out in front of the morning staff shift change. 17 people recorded it on their phones. The video was uploaded to the hospital staff group chat before he reached the parking lot. By noon, it was on local news. By evening, it was national. The disgraced doctor arrested for obstruction of federal classified personnel status. The Navy Cross recipient he'd tried to destroy. The child he'd nearly cost her life to save. His medical license was revoked within 30 days. His criminal case carried a sentence of 8 years federal prison. His wife filed for divorce while he awaited trial. By 18 months later, Dr. Sterling taught CPR fundamentals at Savannah Community College for $15 an hour, his students mostly teenagers fulfilling high school health requirements. He was 47 years old and had nothing left to show for it but a felony conviction and the knowledge that he'd tried to destroy someone he never understood. Sometimes the bravest warriors carry stethoscopes, not guns. If you've ever been underestimated by someone who didn't know your true value, please subscribe, hit that notification bell, and comment below. What would you have done in Laura's position?